Hello, I'm Alice Wilson. I am the Vice Chair of Scotland's Deputy Nurse Directors Forum. The forum was established in 2017 with representation from across Scotland. It was commissioned by SEND following some initial work led by the Royal College of Nursing to support integration joint board lead nurses. The first year saw a really strong start in establishing the forum, and during the second year we've further developed our scope, reach and impact. Moving into year 3, we believe the Deputy Nurse Directors Forum is perfectly placed to offer senior nursing leadership across Scotland in support of the CNO and SEND priorities. And we're ready to take on that additional delegated responsibility to increase our individual and collective influence for nursing and for the people of Scotland. And in doing so, we also recognise the potential for our own development, both as individuals and also as a group of deputies. So what does the forum offer those who attend? Well, the forum has got a committed core membership who greatly value the strengths of the collective thought process and networking to provide support and enhance resilience both within the meetings and out with, and we offer a supportive and, where required, confidential network. We offer excellent opportunities for succession planning as well as professional growth for deputies and aspiring nurse directors. And what outcomes have we achieved? Deputies have chaired and participated in a number of national work streams resulting in tangible outcomes. Some examples of that include the stoma care quality improvement and effective use of support garments work, CVAS Plus, which will deliver a single system across Scotland for delivery of around 80% of high-use IV antibiotics and other preparations, and major incident and mass casualties for NHS boards and health and social care partnerships. Deputies have also provided leadership to excellence in care groups to develop and test indicators and associated metrics to support that Once for Scotland approach. The forum's also offered a significant role in influencing and informing priority national work. Deputies represent SEND on key national groups, enabling senior nursing influence across a range of areas. And two key and current examples of that is where the forum has added significant value and influence is through the Future Nursing Midwife Programme Board and the Health and Care Staffing Scotland work. Both have been standing agenda items on the forum, and we have key connections and structured discussions with the national team, and the deputies have influenced the outcomes. So 2019 has given us the opportunity to reflect and to look at what we do for year 3. We've contacted every member of the forum with key questions, and what members have told us is how much they value the forum and what it offers in terms of personal growth, resilience and networking. The forum has a huge range of skills and experience which we want to use to provide a vital national collective leadership contribution. We are ready to take on additional delegated responsibilities to strengthen the support we can offer SEND and to further develop our leadership potential. We're committed to the CNO SEND priorities, and through the deputies we offer a vital conduit between strategy and frontline delivery. And we also contacted the nurse directors, and what you told us was that you consider our value in networking, in it being an extended resource for SEND, in succession planning, and again that conduit between strategy and practice. The impact you believe we've made is better and more timely coverage of national groups and in influencing SEND. You think the forum could be strengthened through regular joint sessions with SEND, strengthened attendance from all board areas, and having regular feedback item from the deputies on the SEND agenda. You think smart goals and a work plan and delegated responsibilities would be good. So what next? Well, we agree with SEND's view on how the forum can be strengthened, and our ask is that you help us to make this happen in the coming year. We welcome the opportunity to work with and on behalf of SEND to progress the 2030 vision. We are a committed, experienced and proactive group with the vision, ambition, capacity and capability to lead in delegated responsibilities aligned to the CNO and SEND priorities. Through the forum, we'll continue to increase our individual and collective influence to deliver evidence-based outcomes for nursing and for the people of Scotland. Contact details for the group are included on a briefing sheet that we've brought with us today, and I would really encourage you to pick one up before you go. Thank you.